Econazole is a medication used to treat various fungal skin infections such as athlete's foot, jock itch, and ringworm. It can also be used to treat a skin condition called pityriasis, tinea versicolor, which causes changes in the color of the skin on the neck, chest, arms, or legs. Econazole is an azole antifungal that works by stopping the growth of fungus. It's important to use this medication as directed by your doctor and to continue using it for the full prescribed length of time, even if your symptoms improve. Be sure to wash and dry the affected area before applying the medication, and use it regularly to get the most benefit from it. Follow the dosage instructions provided by your doctor and apply the medication at the best time recommended for you. Remember, always consult your healthcare provider for more information about this medication. This medication is meant to be used only on the skin. Before applying, make sure the area is clean and completely dry. Follow your doctor's instructions on how to apply the medication, which is usually once or twice a day. The dosage and duration of treatment will depend on the type of infection. Do not use more often or for longer than prescribed. After applying, remember to wash your hands unless the treated area includes the hands. Do not cover the area unless your doctor tells you to. Avoid getting the medication in your eyes, nose, mouth, or vagina. If it does happen, rinse with plenty of water. For best results, use this medication at the same time each day. Keep using it until the full prescribed amount is finished, even if your symptoms improve before then. Stopping too early may cause the infection to return. If your condition persists after 2 weeks of treatment, or 4 weeks for athlete's foot, or if it gets worse, be sure to inform your doctor. If you experience burning, stinging, irritation, or redness at the application site, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's important to be aware of the possibility of a serious allergic reaction, which is rare. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, make sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada. Before using Zolpak 1%-6cm-X7 topical kit antifungals, make sure to inform your doctor or pharmacist about any allergies you may have, especially to other azole antifungals. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist for more details. Before using this medication, let your doctor or pharmacist know about your medical history. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Zolpak 1%-6cm-X7 topical kit antifungals should only be used when clearly needed. It's important to discuss the potential risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. Always follow your doctor's recommendations for the best timing and daily dosage for this medication. It's important to be aware that Zolpak 1%-6cm-X7 topical kit antifungals may interact with other medications, which could affect how they work and increase the risk of serious side effects. It's a good idea to keep a list of all the products you are using, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication regimen, always seek approval from your doctor. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to remember not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's important not to use it for another infection unless your doctor instructs you to do so. If you're using this medication to treat pityriasis, it's important to note that it may not cause a return to normal skin color immediately. It may take several months after treatment is completed for your natural skin color to return. Make sure to follow your doctor's instructions closely and be patient with the results. If you forget to use a dose, just use it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and use the next one at your regular time. Don't take double the dose to make up for the missed one. Be sure to store this medication at room temperature and out of reach of children and pets. It's important to not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.